Welcome to the deep dive. We're jumping into a topic today that's incredibly important and, frankly, a little scary for any pet owner: hypovolemic shock in dogs and cats.
It really is. A true emergency situation where understanding what's happening is critical.
Exactly. It's life-threatening, and time is absolutely of the essence. We've actually got a whole stack of information here sent in by a listener who wanted us to go deep on this.
Ah, good stuff.
Yeah, everything from the core principles vets learn, some really specialist level material, alongside some key basics on signs and treatment.
Okay, great. So we can really unpack the what and the why it matters for our pets.
That's the plan. We'll guide you, the listener, through this material. Our mission is to pull out the essentials: what hypovolemic shock actually is, what causes it, how you might recognize it, and how it gets diagnosed and treated in that emergency setting.
Sounds like a plan. Where should we start?
Right, let's dive straight into the definition from these sources. Hypovolemic shock. What is it, fundamentally?
Well, at its heart, it's about not enough fluid volume circulating in the blood vessels. That's the key circulating volume.
Okay.
And because there isn't enough volume flowing, the body can't deliver oxygen and nutrients properly to the tissues and organs. That failure of delivery, that's what we call poor perfusion.
So inadequate circulating volume leading to poor perfusion. Got it. And that's different from just being dehydrated.
Yes, exactly. And the sources make a really important point here. Dehydration is more about a total body water loss, often starting in the spaces outside the blood vessels. Hypovolemia is specifically a lack of volume inside the vessels. Now, severe dehydration can definitely lead to hypovolemia.
Right, if it gets bad enough.
Precisely. But they aren't the same thing initially, and sometimes the immediate treatment focus differs slightly. So that distinction is pretty important clinically.
Okay, that makes sense. So the problem is this critical loss of fluid volume. What actually causes that loss? The sources seem to break it down into two main buckets.
They do. Basically, you can lose volume either through bleeding, that's hemorrhage, or through losing other essential fluids like plasma or electrolyte-rich fluids.
Let's tackle hemorrhage first. Losing blood. Where can that happen? Seems obvious, but maybe not always.
Right. You've got the obvious external bleeding, big cuts, trauma like a car hit, bite wounds, maybe bleeding after a surgery.
The stuff you can usually see.
Stuff you can see.
Yeah.
But then there's internal bleeding, which is often much sneakier. It could be from a ruptured tumor, maybe on the spleen or liver, sadly common.
Oh, yeah.
Or internal damage from blunt trauma, even if there's no outside wound, bleeding into the chest cavity or the abdomen.
Harder to spot initially.
Much harder. And then there are issues with the blood itself not clotting properly.
Ah, the sources mention coagulopathies.
Yes, exactly. Things like rat bait poisoning that stops clotting. Severe liver disease can affect it too. Or inherited disorders like hemophilia or von Willebrand's disease. Even significant bleeding from, say, stomach ulcers or really severe gut inflammation can lead to hemorrhagic shock.
Okay, that covers blood loss pretty thoroughly. What about the other category, losing fluids that aren't blood?
This is about losing plasma or other body fluids critical for maintaining volume. The sources really highlight severe vomiting and diarrhea. Think about diseases like parvovirus or hemorrhagic gastroenteritis HGE, massive fluid loss there.
Right, just pouring out.
Literally. Or losing fluid through excessive urination, maybe from uncontrolled diabetes or acute kidney injury or hormonal issues like Addison's disease.
Burns too, right? That causes fluid loss.
Huge fluid loss. Burns damages the skin barrier and fluid just weeps out. And then there's something called third spacing.
Third spacing.
Yeah, it's where fluid leaks out of the blood vessels into other body spaces where it shouldn't be, like into the abdomen during pancreatitis or peritonitis. The fluid is still in the body, but it's not in circulation where it's needed.
Fascinating. And even just not drinking enough if an animal is sick.
If they're sick, not taking in fluids, and still having normal ongoing losses, yes, that can absolutely contribute, especially if it goes on long enough.
What's really interesting from the sources is this idea that hypovolemic shock is always caused by something else. There aren't risk factors for the shock itself, just for the underlying conditions.
Exactly. It's a consequence, a syndrome, not a primary disease.
So the body starts losing this critical fluid. What happens next? It must try to compensate, right? This is that shock cascade the sources get into.
Absolutely. The body has powerful immediate responses. As soon as it detects that drop in circulating volume and blood pressure, the absolute priority becomes keeping blood flow going to the brain and the heart.
Survival mode kicks in.
Big time. Sympathetic nervous system fires up. That's your fight or flight. It floods the system with adrenaline-like hormones.
And what does that do?
Two main things initially. One, it causes intense vasoconstriction blood vessels in the limbs. Skin, gut, kidneys clamp down hard, trying to shunt blood towards the vital core organs.
Rerouting the supply.
Precisely. Two, heart rate shoots up, and the heart beats more forcefully, trying to pump that reduced volume around more effectively.
Seems like a smart response initially.
It is, in the very short term. The body also triggers hormonal systems, like the renin-angiotensin-aldosterone system, to try and retain sodium and water. And dogs have a neat trick. Their spleen can contract and squeeze out a reserve of stored red blood cells. Like a little internal blood transfusion gives a temporary boost. Fluid can also shift from the spaces between cells into the blood vessels. This whole effort is the compensated phase.
The warm shock phase mentioned in the sources.
Sometimes, yeah, especially in dogs. They might initially feel warm because of all this internal activity before the peripheral shutdown is complete.
Yeah.
The body is working incredibly hard to maintain perfusion. Some sources say a healthy animal might tolerate losing maybe 10% of its blood volume and still look relatively okay in this phase.
But that compensation can't last forever.
No. If the fluid loss continues, or if it was too massive to begin with, these mechanisms get overwhelmed. The vasoconstriction becomes so severe that even vital organs start getting insufficient blood flow.
Ow!
And the tissues starved of oxygen. The skin, the gut, the muscles, they can't make energy normally. They switch to anaerobic metabolism.
It produces lactic acid.
Exactly, lactic acid. And as that builds up systemically, it causes metabolic acidosis. This acid state is toxic. It poisons enzyme systems, weakens the heart muscle directly, and eventually it causes those constricted blood vessels to just give up and dilate.
So the pressure crashes.
Blood pressure plummets. The vessel linings get damaged. Tiny little clots can form, making perfusion even worse. It becomes a devastating downward spiral.
And the sources specifically called out the GI tract in dogs as a shock organ?
Yes, that's a really key point from the dog-specific material. The gut in dogs seems particularly vulnerable to damage from this lack of blood flow ischemia. The lining can break down.
Leading to bacteria leaking out?
Exactly, bacterial translocation, which adds sepsis to the whole mess. If this severe lack of perfusion isn't corrected fast, you get irreversible cell damage. Organ failure kicks in, multi-organ dysfunction syndrome, or MODS, and ultimately cardiovascular collapse and death.
Okay, that cascade is terrifying. Which brings us to what we might see. What are the signs, especially differentiating between that compensated phase and when things are really going downhill?
Yeah, this is crucial for you as a pet owner. The signs really depend on where the animal is in that cascade. Early on, in compensated shock again, maybe more obvious in dogs, the signs can be subtle.
Okay.
The heart rate will be high, maybe very high. Pulses might feel strong, even bounding initially because of that high pressure from vasoconstriction. Gums might look pink, or even a kind of brick red.
Brighter than usual.
Yeah, sometimes. And the capillary refill time, when you press the gum and see how fast the color returns, might be really fast, like less than a second. The animal might seem anxious, restless. Extremities could feel warm. Blood pressure might even be normal or high at this point.
So they might not look like they're collapsing, but things are already going wrong internally.
Precisely. That's the danger of compensated shock. But when those mechanisms fail, they enter decompensated or cold shock. Now, the signs of poor perfusion are obvious.
This is what people usually think of as shock.
Probably.
Yeah.
Weakness, lethargy, maybe stupor, or even coma. Collapse. Gums become pale, white, or kind of muddy gray because blood is shunted away.
Okay.
Capillary refill time is slow, takes 2 seconds or more for the color to return. Pulses, like in the groin or feet, feel weak, thready, hard to find. Extremities pause, ears feel cold.
And heart rate, still high.
Usually still high in dogs, yes.
Yeah.
But cats, and the sources really stress this thing, cats often become profoundly bradycardic in decompensated shock. Their heart rate goes down.
A low heart rate in a collapsing cat is a really bad sign then.
A critical sign, yes. You'll likely see rapid, shallow breathing too. Maybe signs of severe dehydration like sunken eyes or skin that stays tented when you lift it. And of course, you might see signs of the underlying cause, bleeding, vomiting, etc.
History is key then, seeing those changes.
Absolutely. And recognizing that pale gums, weakness, cold extremities, collapse. That's an immediate, life-threatening emergency.
So a pet gets rushed to the vet showing some of these signs. How do they confirm it is hypovolemic shock and sort it out from other things that might look similar?
Well, the first and most crucial step, according to all the sources, is that hands-on clinical assessment of perfusion, checking the heart rate, Pulse quality, gum color, capillary refill, extremity temperature, mental status, doing it right away, and then repeating it constantly to track changes.
Monitoring the trend.
Exactly. And getting the history from you is vital. What happened? What signs did you see? How quickly did they develop? That helps point towards the likely cause of fluid loss.
And they need to rule out other types of shock.
Yes. The sources touch on this. Is it cardiogenic shock? You'd look for signs of heart failure alongside the poor perfusion. Is it distributive shock, maybe from sepsis or anaphylaxis? That often presents differently, sometimes starting warm but without the volume loss component. Or obstructive shock, like a clot blocking flow. So finding evidence of volume loss is key to diagnosing hypovolemic shock.
What about specific tests they run right away in the ER?
Blood pressure measurement is fundamental. You need to know how low it is and track its response to treatment. Direct arterial pressure is ideal if possible, but cuff pressures are used too.
Okay.
Blood lactate levels are highlighted as being incredibly important. Elevated lactate, usually defined in the sources as over 2 or 2.5 millimol, is a direct indicator that tissues aren't getting enough oxygen. It quantifies the shock state.
And watching it come down means treatment is working.
Precisely. Measuring it serially is key. They'll also run a quick PCV and total solids. Packed cell volume tells you about red blood cells. Total solids about protein.
And that helps differentiate the cause.
It can. High PCV and high TS often points towards dehydration or plasma loss. Low PCV with low TS strongly suggests hemorrhage, blood loss. They'll also check blood glucose. It can drop dangerously low in shock electrolytes and often blood gases to assess the acid-base status, looking for that metabolic acidosis.
And imaging. Ultrasound was mentioned.
Yes, a quick bedside ultrasound scan, sometimes called AFAST or TFAST, is incredibly useful. It takes just minutes to look for free fluid in the abdomen or around the heart or lungs.
Checking for internal bleeding.
Exactly. Or other fluid, like in third spacing. It can also give a quick assessment of the heart. If the patient is stable enough later, X-rays might help find underlying causes. All these diagnostics work together to confirm shock, gauge severity, and find the trigger.
Okay, so they've confirmed it's hypovolemic shock. The sources are unanimous. This is go time, intensive care needed. What are the immediate goals?
Restore volume, deliver oxygen, stop the loss. That's the mantra. Maximize blood oxygen. Restore blood flow with fluids. Control whatever is causing the fluid or blood loss, and then provide ongoing support. But rapid fluid resuscitation is job number one.
How do they get those fluids in fast enough?
Getting vascular access is the absolute priority. That means placing intravenous catheters, ideally large ones, and often more than one.
Big couvoirs?
Big foys. And the sources also mention intraosseous or IO catheters. That's where a needle is placed directly into the marrow cavity of a bone.
Into the bone. Wow.
Sounds dramatic, but it provides very rapid, reliable access to the circulation, especially when veins are totally collapsed and hard to hit in severe shock. It's a lifesaver sometimes. And oxygen therapy starts immediately too, usually by mask or flow-by, to boost oxygen levels in the blood that is circulating.
And the fluids themselves, what do they use first?
First line is typically isotonic crystalloids. These are fluids like lactated Ringer solution, Normasol, Plasma-Lyte balanced electrolyte solutions that resemble the body's own fluid.
Like replacing what was lost?
Essentially, yes. They're given in rapid boluses. The sources give typical starting ranges, maybe 10 to 20 milliliters per kilogram for a dog, given over 15-20 minutes. For cats, it's less, maybe 5 to 10 mils per kilo over the same time frame, because cats are more sensitive to volume overload.
Smaller boluses for cats?
Yes, smaller, more careful boluses. But the crucial thing isn't just the starting dose, it's titrating to effect. Give a bolus, then immediately recheck those perfusion parameters: heart rate, pulse quality, gum color, blood pressure, mental status.
See if it worked?
Exactly. If they're still in shock, give another bolus. You keep repeating this cycle until perfusion improves. Some sources also mention using hypertonic saline, a very concentrated salt solution for rapid but temporary volume expansion by pulling fluid into the vessels.
What about other types of fluids, like colloids or blood?
Good question. Colloids, like hetastarch, are larger molecules. They stay within the blood vessels longer than crystalloids and exude more pull to hold fluid there. They might be used in very severe shock or if the animal has lost a lot of protein. And blood products are absolutely critical if the cause is significant hemorrhage or a clotting disorder. Whole blood or packed red blood cells are needed to replace oxygen carrying capacity if the animal is anemic. Fresh frozen plasma provides clotting factors, and albumin, if those are deficient.
But the sources stress that fluids alone aren't enough, right? You have to fix the underlying problem.
Absolutely fundamental.
Yeah.
Pouring fluids into a patient that's still actively bleeding internally is like trying to fill a bucket with a hole in it. You must control the source of the loss.
So pressure on wounds, maybe surgery.
Direct pressure for external bleeding.
Yeah.
Emergency surgery might be needed for internal hemorrhage. Specific treatments for things like rat poison or medications to control severe vomiting or diarrhea. That has to happen alongside or immediately after resuscitation starts. Then, once perfusion is restored, the slower correction of the dehydration component begins over the next 12-24 hours.
And it's not just fluids, it's ongoing monitoring, pain relief, warmth.
Yes, it's true intensive care. Constant monitoring of vital signs, lactate, urine output, PCVTS. Pain management is critical. Keeping them warm because shock patients lose heat easily. Supporting the gut, providing nutrition once stable. It's a whole package deal to manage the systemic effects and prevent complications.
Given all this, what do the sources say about the prognosis? What are the chances for these pets?
It really varies. The overall message is that prognosis can be fair to good if it's caught early and treated aggressively and promptly, especially if it's caught in that compensated phase and the underlying cause is something manageable.
That makes sense. Early intervention is key.
Hugely key. But conversely, the prognosis becomes much more guarded, even poor, if the animal arrives in late-stage decompensated shock.
Or if the cause is really bad.
Exactly. Uncontrolled bleeding, severe multi-organ dysfunction already setting in, or cases that just don't respond well to that initial aggressive fluid therapy, those have a significantly worse outlook. As the sources say, time is critical. Every minute perfusion is inadequate, causes more cell damage, and lowers the chance of survival.
Are there complications from the treatment itself to worry about?
Yes, the sources do mention potential issues. Fluid overload is probably the most watched-for complication, especially in cats or animals with underlying heart issues. Giving huge volumes of crystalloids can theoretically dilute clotting factors or protein levels, though often less of an issue in the initial hour. Mostly, the complications relate back to the severity of the shock itself, ongoing anemia, electrolyte problems, organ failure progression, even cardiac arrest.
We've touched on this a few times, but the sources dedicate specific attention to the differences between dogs and cats. Can we summarize those key distinctions?
Absolutely, and this is vital for anyone dealing with emergencies. The underlying issue, low volume, is the same, but how they present and sometimes how they respond to treatment can be quite different.
So how does the presentation differ most strikingly?
The big one is that initial phase. Dogs, as we said, are more likely to show that warm or hyperdynamic compensated shock, fast heart rate, bounding pulses, maybe those brick red guns. Cats often seem to bypass that entirely. They tend to crash straight into cold hypodynamic shock. They're often profoundly depressed, hypothermic cold with pale or muddy gums, weak pulses.
And the heart rate difference.
And the critical heart rate difference, yes. The sources emphasize this repeatedly. Cats in decompensated shock are often bradycardic slow heart rate. Dogs are usually tachycardic fast heart rate throughout most stages of shock. That low heart rate in a sick cat is a major alarm bell.
So recognizing shock in cats can be trickier because they might just look really dull and cold, not agitated.
Exactly. The signs can be less dramatic initially, more just profound depression and coldness, but they can decline incredibly fast. And then there's the fluid tolerance difference.
Right, cats are more sensitive.
Much more prone to fluid overload and pulmonary edema. Dogs generally tolerate bigger, faster fluid boluses. That's why vets are more cautious with fluid rates and volumes in cats, using those smaller boluses and monitoring very closely for any breathing changes.
And the shock organ difference you mentioned earlier.
Yeah, another important point from the sources. In dogs, the gastrointestinal tract is often considered the primary target organ for damage during shock. In cats, it's frequently the lungs that are considered the primary shock organ.
Making them more prone to lung injury.
Exactly. Things like ARDS, acute respiratory distress syndrome, or pulmonary edema. And remember the spleen trick. Dogs can auto-transfuse red cells from their spleen. Cats don't really have that reserve capacity. These species-specific nuances are critical for accurate diagnosis and tailoring the treatment plan effectively.
Wow. Okay, that was definitely a deep dive. We've covered a huge amount based on these sources, the definition, the wide range of causes, that complex shock cascade, how to spot signs, those vital dog versus cat differences, the diagnostic steps, the emergency treatment essentials, and the factors influencing the outcome.
You really should have a much clearer picture now of just how serious hypovolemic shock is, how quickly things can spiral, and why that immediate, aggressive veterinary intervention is so absolutely critical.
It really underscores why we need to pay close attention to our pets and get help fast if they seem unwell, especially with things like severe vomiting, diarrhea, or any signs of bleeding or collapse.
And hopefully understanding the why behind the signs.
Mm-hmm.
Why the gums go pale, why the heart rate changes, why lactate matters, why cats get smaller fluid boluses, helps make sense of what happens during such a stressful emergency. It's not random. It's physiology under extreme stress.
So, for you listening, what does this mean? Maybe it's about being better prepared to recognize potential warning signs. Or perhaps it just offers a deeper appreciation for the complex biology of our companions and the incredible speed and skill involved in veterinary critical care.
And it brings up a fascinating thought, doesn't it? Thinking about how the body's own desperate attempts to survive that initial vasoconstriction, for instance, can actually contribute to the damage later on. How does understanding that complex interplay, where survival mechanisms can become detrimental, change how you think about medical intervention in any critical illness? It's a reminder that treatment often involves working with the body's responses, but sometimes needing to actively counteract them to restore true balance. Definitely something to mull over.